for this. All right, let's start, everyone, and we will start do a full stretch out today. If you did that class before, that's fine, but let's do it. So we get to sit down a lot all day, and we are getting tight and tight and tight and tighter. So let's get into it. We're going to stretch out the whole body, and we're going to do some flossing. I'll teach you some new stuff about that, which I haven't really covered in your classes, but some of it I'll do it with musos, and some of it I'll do it with like running athletes. But I haven't had to do it with you guys because you guys are a bit younger and just you're not training like 4 hours a day, so you don't get that as much. But I'm going to teach you today. All right, so let's start with, first of all, shoulders. Okay, we're going to loosen out the neck and the shoulders. Good, 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 good. And the other way, big circle in this way. Okay, one arm back. Open up the body first. This is very, very important. Okay, we open up the body with this other arm. Okay, we're doing great. Okay, good. 2 arms back. This is the last time you're seeing all this drumming equipment. This is gone, so there'll be more room for me to kick around in here, which is good. Okay, now what we're doing is crisscrossing. Go like this. Just opening up the chest, one arm over the other. Okay, it's a mobility type of stretching session rather than a stretch session to get flexible. Okay, up and down. The difference is how long we hold things for. See, we're doing mobility here. We're actually moving things to the joints and getting to the edges, yeah. And opening up the body through there. All right, now let's start from the neck down. All right, there's a couple of new ones. Neck. Get rid of that screen time. Focus on your breathing. If you're finding an angle, push that through the other way. Just draw the biggest circle with your nose. Look over the shoulder. Tilt side to side. So today's session is not a sweat session, so to speak. All right, cool. Now, here we start with a couple of stuff you haven't done before. So you're going to put your hand up and you're going to like, it's called the shoulder dislocation. I'm lifting up and just really opening it up and just trying to get that open and out. All the way out. Good, get the other arm out. All the way. Try not to bore you with my COVID belly. All right, now 2 hands up, or here it comes. All right, so I'll just link my hands together, I'll lock my hands together, and all the way up. Push both through, squeeze your ears, and lift up your shoulders. All right, so now here's the one that is for the musos. Just let me fix this for a second. Sorry, so you can get better light for you. All right, here's this one for the musos. I put my hand out. All right, and stop in the name of love, and I'm twisting. And you feel it's going to get in the shoulders here, and I'm flossing the muscle. You know when you floss your teeth and you get between your teeth, if you floss, okay, your gums get better. This is that. So I'm doing this. Now I'm going to do it to the side. You're going to feel it differently again. Okay, now keep on doing that, and now turn your head away as well. All right, relax. Let's do the other arm. Okay, so this way. I've got a shoulder injury at the back here, and I really feel it grabbing in there. And I'm just going to floss that muscle out this way. Now I'm going to do it to the side, still looking forwards. The back bit this way is what's really important. I pull my fingers right back, and I look away as well. And I could be doing that a lot more, obviously, to get a lot more effect. Now watch this one. This is called a Kozak stretch. So my arms are out. It's going to be there. One hand turns down this way, and the other hand turns the other way. And I rotate this way. Okay, it's a Russian stretch from the Kozaks. Don't know who the Kozaks are? You don't need to, because you live in Australia. But if you are interested, you should search it. All right, so twist in one way and twist in the other. Okay, fast. But more important than fast is twist a lot. All right, and time. Okay, there's that one that I wanted to do for you guys. All right, now we'll do the intercostals and your lats. So we're going to go, intercostals are the muscles between the ribs that allow the ribs to breathe in and out. All right, so we're going to go over and my arm is turned up, my palm is facing up and reach as far as I can, over and slightly downwards. All right, and switch to the other side. And other side, we're doing everything twice. Here. And the other side. You're going to feel really good after all these stretches today. Mobility stretches. All right, cool. So we did that twice. Now we'll do these ones again twice. So go hand out, twisting this way 5 times. 4, 5 to the side, 5, 4, 3, 2, 1. Look away 5 times. 4. Gets rid of all the tightness in the neck. And 5. Let's go the other hand forward. 5. Oof, feel that right in the injury. Make sure if you're coming on, please make sure you're on mute. Otherwise, it's just it's annoying for everyone else. Unless you need to ask me a question, of course. Okay, go to the side. This way. Welcome, Matthew. All right, we're just doing this. We're doing a whole bunch of stretching. All right, and look over the shoulder. Undoing the neck, undoing the sitting position, undoing all the computer screen time. All right, good work. And the Kozak stretch, so remember 2 hands out. I'm gonna go one way and one the other way. Go. Really twist as far as you can. It's like you're wringing everything out the opposite way. Okay, flossing. All the way through. Go for more. 1, 2, 3, and 4. Opening up your intercostals and your lats as far as you can. Go for it. Behind your ear if you can. Okay, the other side. And again, the other side. And the other side. Okay, great. I'm just going to drop my screen down a bit. Give me a second. All right, and now here, one hand down, drop as low as you can. Try and get the back leg far. It's like doing the splits, not with your front leg bent. Okay, now we'll switch legs and hands all the way out. Okay, really feeling the leg there. Try not to bend this leg too much. Try and push it through. Remember, every stretch twice. 3 is better. We'll hold it for about 5 seconds on each one. We'll switch. Make sure your knee's not falling out. Keep it in, tight, the front knee. And switch again. And make sure your knee's not falling out that way. It's in. Great. We go down to the floor more. And we do the frog stretch. So my feet are together at the back. My legs are out wide. I'm just going forwards and backwards and finding a stretch. I'm doing the splits with my legs bent. And now we're going to try and lie down on the floor. Let the legs go wider. And again, going forwards and backwards. Open out those hips. Undoing that sitting position. Teaching the body to move the correct way. Maybe you're always sitting up with one leg folded on the couch or in your chair and the other leg's not getting that, so you're evening everything out. Now try to lie your belly down to the floor. Let's go 5, 4, 3, 2, and 1. And come up all the way. Stretch up, suck your stomach in. And lie down again, all the way flat on the ground. Some of you might find this easy, some of you harder. Either way, it's good for you. And we come up again, like a push-up position. Suck your stomach in, put your belly in, up. All right, great. Next one. So we've done there, back is in there, in the joints. When your legs are bent, You're getting more in the ligaments area rather than the muscle. All right, and that's a different benefit. So now we're folding the legs in this way. And I want you to know that your back foot should not be out to the side like this. Because this is how you get knee injury on the inside of your knee, which is called your medial collateral ligament. You get your foot over. If you can, of course, if you've got injuries, you don't. But you sort it out the best way you can for yourself. Make sure it's not under your bottom. Make sure it's out to the side so your bottom can go down. There's a front leg and a back leg. So let's go chest on the front leg to make it the easiest one possible. Holding it for a couple of deep breaths. And then to come all the way up. And now we're going to try and put our belly onto our sock. Okay, or onto our ankle here. And you hold on with one leg and pull down. 5, 4, 3, 2, and 1. And then you're going to come up to a bent leg. Okay, remember what I said, not to have your foot out like this. Try and have it over. Right, and we're going to grab with 2 hands and then pull down. We're really opening up the hips here. If you love flexibility, you're going to feel great after this. If you feel like you're as stiff as a tree trunk, but even the tree trunk has got movement in it. All right, so now let's swap everything over. So we'll do the other side and then we'll repeat again. Remember, twice. Front leg, okay, is the easier one. Down. You feel it in your glutes. Couple deep breaths. Now to the center. Again, you come up. Belly tries to go on the ankle. Right, that's our aim. Right down. Focus on your breathing. And now we're going towards our bent leg. And we're really using our muscles, our biceps, to pull down. All right, and let's swap it all over again. We're going to repeat it a second time. Told you today's not a heavy session in regards to cardio or anything, or strengthening. But why not do this so you can understand the real benefit of it. Let's go front leg. Ready down. 5, 4, 3, 2, 1. All the way up and then down to the center. 5. You feel like you're better the second time. 4, 3, 2, 1. Up and down to the bent leg. Go down. 5, 4, 3, 2, 1. Swap the legs over, and then we're done with this kind of stretching. Okay, down to the front leg. And we're here. 5, 4, 3, 2, and 1. And down to the bent leg, sorry, down to the ankle. Go down, pull really down, use your muscles. 4, 3, 2, 1. And last one, 2 hands grab onto the knee, pull down. 5, 4, 3, 2, 1. All right, let's loosen up the hips. Let's let them go side to side, windscreen wipers like this. We'll do this a few times to get the blood flow through them. And now we're going to work their insides. So what I do here, so I can put one leg on the inside of the wall there. See, you don't have to use the wall at all. And I kick that and then I push the other leg out that way. And that will help to open up the hips as you see it happen to me. All right, so here I am, minimal stretch, well, for myself. Okay, and I push it out.
Freeze for us.
All right, make sure you're on mute, please. All right, and here. Now one hand behind and we'll reach up. 5, 4, 3, 2, 1. Let's go the other side. All the way up. 5, 4, 3, 2, and 1. 2 hands in front, and we try and get one elbow, if that's easy. Second elbow. And then you're trying to lie down more, whatever you can do. Now, what I'll do, give you a trick here. All right, you put one hand on top of the other. I'll read what you're writing in a second. I know some of you've written. Okay, one hand on top of the other. And what we'll do is go down and put our head onto our hand. And we rest our head on there. But if that's too easy, you take out a hand and just go on one hand And if that's easy, then you go flat. And if that's easy, you do it like my daughter does and goes flat belly on the ground. All right, and relax. Let's do that again. One on top of the other. Go down. Then down to one hand if you can, or hold the other. Hands flat. Lie down on your hands. And relax. All right, one more time. Reaching all the way up. Up. 5, 4, 3, 2, 1. Switch. 5, 4, 3, 2, and 1. Bring your legs in. Just shake them out a bit. Okay.
You're frozen.
Am I frozen? No?
Yeah, it's very like glitchy.
All right. I'm going to take it inside. All right, guys. Let me take it inside. I'll write it in the screen. All right, sorry. Okay, I'll just pause this as well. Okay, so I had to bring it in because it was bleaching. All right, so I'll get rid of this cup in a second. All right, so we were there where we had our legs out wide. All right, so you've got to get rid of the stretcher start again there. So here we are. So legs are out. You're driving a big bus. All right, and what you're going to do, go over and trying to grab down on your ankle. So your toes, hold it 5. If you can't, you just drive out. That's it. All right, so let's go to the other side. So if this is all you can do, you do that. You can support yourself there. But I've got the aim always to try and come down and find my foot. If it's done a lot longer, obviously I'm going to find it because in my head is, if I don't find it, then obviously I'm losing what I used to have, and I don't want that. All right, as best as I can. Go over again, second time. And last time over. Thanks, Ian. All right, cool work. All right, there's that. I'm just going to fold this card up because it doesn't work for me. Some further hard floor. All right, next thing is, can you come up and we're going to be on the balls of the feet. All right, and we're moving forwards and backwards there, creating that nice space for the front kick. So I'm moving on the balls of the foot there. Okay, just get the next scissor there. All right, for you guys, I'm going to take you guys to the next level. We're here, we put our foot in, and what I'm going to do is I'm going to drive forwards on that, trying to get my heel on the ground. Now, this one I haven't done that, guys, much, if at all. Bless you, Marianne. All right, so I'm driving that in, and that's working my ankle here and opening it up so I never get a knee injury or an ankle injury. All right, so moving through. Let's do the other leg. I'll just pick a few. I want to do about 10. 20 is better for a reason. There's a reason for it. I'll go into the details. So even moving it through, but remember I'm doing it twice. I will get my 20s in. Let's swap it over again. You find later when your ankle's working so much better. This one is a brilliant exercise so you can get a big squat without your heels coming up off the ground. Okay, we're driving through. Remember not to let your foot fall out. It's right in the middle. Everyone, this is how you used to fix everyone's knee injuries by doing this. So they can do a deep squat. All right, and just do sideways there. Let's do the other leg. Okay. All the way through. All my athletes outside of Taekwondo, especially runners. I used to do this a lot with runners. Okay, so we get the ankle flexibility. And then anyone that had an injury there. If they have an ankle, you make a bad knee for you. All right, so we did that. So we've got that beautifully there. Now the next thing we're going to do is this. I'm going to do it sitting down actually for you. We're going to do a floss of the hamstrings. I'm not going to do this standing. This is what you're going to do. We're leaning back. Okay, just watch. I have my foot up, there's in and there's out. All right, so you're going to start with your foot in slightly. You're going to kick your leg out and wipe it out. So you did a wipe out, yeah. So in, I'm sure you can see what I'm just doing now. Okay. Sorry about that. Yeah, She had to lie down right in front of the screen. All right, again. So here we are. So I go in, with my foot in, and I flush it out 5 times. 2 and 3 and 4. Just changing angles so you can see different. 5 and 6. All right, that was 5. Yeah, 6. All right, let's do the other leg. 1 and out. You see, I'm really turning back at my foot. 2 and there. 3. Like you floss your teeth, you should. I'm gonna admit to you I don't. I should. Everyone knows that's got better teeth than me does. This is called a floss. Let's do the other leg again. Ready? In and out. So you have to start inwards and then go out. And this will stop a lot of hamstring injuries. And you're strengthening your quadricep as well. All right, good. And this is the other leg. So health and wellness, I mean, you can be as hard as you want, but all the hard guys that I know, when I say hard, as in they're tough and they wouldn't back down and everything, all my mates that are like that, at my age, they're broken because they were too tough to do all this wellness stuff. What's that crap they used to say? What's that you do there, Tom? You know, that's 15 minutes you've wasted in the training session. I go, no, start 15 minutes earlier. No, that's a waste of time. Now they're all crippled, knee replacements, and this and that, and I've trained a lot harder than them. And I'm not blessed with better genes. I'm blessed with better parents that taught me how to do it correctly. And then I went on further there. All right, so you saw that one, that's that. Right, now the last one we're going to do is going to be a mix here. So we're going to do the thigh stretch. So I'm here, I'm stretching out the front of the shins, so everything's flat on the ground. Okay, and this is what we're going to do first. We're going to lean back. 1, 2, I drop my shoulder back. 3 and 4. You can do that with me now, as if it was the first time. 1, 2, 3, and 4. Sorry if my internet is in unstable. I'll do that first to see if I've got a back problem. All right. Because you might have had a good day every day, but one day it goes. So I'll do this first to see if it grabs me. If it does grab me, I'm going to just move it around. If it doesn't grab me, then I'm ready to actually lean back on one and lean back on the other. And I keep my hips up. And I follow the stretch. Then I come back up, push myself up, and I'm going to fold the other way. Okay, so the things don't tighten up in my ankles. Downward dog. All right, back down to fit flat if you can. Any injury you have, look up yourself. Go back on your elbows, and if you can, go back further. I'll put my head down first, and then I'll lie all the way down and try and let my belly come in. When I'm ready to come up, I put my weight on my head, then my elbows, then my hands. I go the other way and downward dog. And try to push my heels flat into the ground. And now I walk my hands back and I try and grab onto my ankles if I can. Then my feet if I can. My fingertips to the ground if I can. My knuckles, I'm just going next to the next level. And I'm trying to get my hands flat on the ground. I never could do this, but someone challenged me when I was a teenager in class. And anyone that challenges me knows that I will go. And the last one is behind and down, look through. And you're going to come all the way tall, shake it out, and we're going to do that again. So we go down, ankles, if you can. This is the minimum I want you to get to. All right, it could be a 3-month training plan to get to here, but you need to be able to get to here. All right, shoelaces, floor, knuckles on the floor. Now we're getting really deep. Hands flat on the floor with your legs as straight as you can. And last line, grab it high. Use your biceps to pull yourself in. 5, 4, 3, 2, 1. You come up slowly. If you did that well, now you're loose and you're ready, but you're not ready to start kicking. Now, this is where injuries happen. You go, I just stretch, bang, 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 you start kicking, and then everything is loose. Your muscles are used to being tight, and now they're loose, whoop, and they grab twice as hard. All right, so remember what I'm telling you, especially the older generation here. Okay, if you're in your 20s or 30s or 40s or 50s, 60s, all right, more and more. All right, so you've got to really move things through. Okay, kind of just like, don't go too far, just like let the blood flow. All right, we'll work through. All right, now do some star jumps. I don't go hard on the star jumps. Let's just do 50 just to get the blood flow going everywhere again. Ready? 50, go. 1, 2, softly. 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3. Make sure you're soft. 4, 5, 6, 7, 8, 9, 10, 20 more. 2, 3, 6, 7, 8, 9, 10 more. 1, 2, 3, 4, 5, 6, 7, 8, 9, aho, and yo. All right. Shake it through. I want you just to go for a walk, an actual walk. Get yourself a sip of water, and we'll come back.